Hey, it's Dave here, and we are going to talk about how to treat heartburn, or at least how the medical system approaches the treatment of heartburn in this video. So if you ever had heartburn, you may have reached for some over-the-counter products. You may have gone and seen the doctor who has prescribed some kind of medication for helping you to reduce the symptoms of the heartburn and the acid reflux. So let's start with the over-the-counter medications. Most people, apart from young children of course, can go into pretty much any chemist, any pharmacy, and grab a box or a bottle of antacid fluids or tablets. And what these over-the-counter products tend to do, things like Tums and Gaviscon and Rennie, and there's Rolaids and things like that, is they tend to contain ingredients that are alkaline in nature. So things like calcium carbonate or sodium carbonate or bicarbonate, things like that. Alkaline molecules that help to quench or neutralize the stomach acid. And of course, the goal with that is to bring up the pH level so that any extra acidity doesn't irritate the gut tissue or doesn't splash back up into the esophagus. Now, there are pros and cons to that. I think that's a perfectly legitimate strategy if you have heartburn just every now and again, you know, once in a blue moon. If you've got some of these in the cupboard and you want to just ease the symptoms, maybe you've eaten something that you don't normally eat or drunk something that you don't normally drink or whatever the case may be. Now and again, having something like that just to quench the symptoms is no problem at all. The problems occur when you're needing to take those things on a regular basis, because then you're not getting to the underlying cause of the problem, right? You're just trying to brush the symptoms under the rug, so to speak, bury your head in the sand and ignore them. And that's dangerous because, as we've seen in previous videos, heartburn and acid reflux can be caused by underlying issues that can lead to major problems later in life if you don't deal with them. Now, one extra little trick there, a lot of people actually find that just drinking some milk helps quench their heartburn and acid reflux. Again, perfectly legitimate strategy unless you're allergic or have a sensitivity to milk, of course. Milk's pH is somewhere between about 6.5 and 7, so it's not quite alkaline, but it's getting there. It's just ever so slightly acid. So even though it's ever so slightly acid, it's less acidic than the stomach environment, and so it can just help to bring up the pH and ease the symptoms a little bit. If these don't work, or if people choose to go to the doctor anyway to get checked out, oftentimes what will happen is the doctor will prescribe one of two different types of acid blocking medications. And these work in a different way. So whereas we're trying to just alter the pH with alkaline ingredients with these products, what we're actually trying to do, or what the medications are trying to do with the prescription products, is they're actually preventing the production of stomach acid in the first place. So it's acid neutralization and it's blocking production, two different concepts. The older versions of these medications were called H2 blockers, and they include brand names like Tagamet and Zantac. And then the newer products, the new kids on the block that came around in sort of the late 80s, early 90s, were proton pump inhibitors, or PPIs. And they include things like Prilosec, Nexium, and what have you. And you'll sometimes see them written by their actual molecule name, sort of the patented molecule name, which are things like omeprazole, pantoprazole, lansoprazole, esomeprazole, etc. Now, the proton pump inhibitors pretty much stop acid production dead in its tracks, and they have quite a long-lasting effect, many, many hours. And so these guys really smash down the acid levels in your stomach. And that can be really, really helpful in the short term for alleviating the symptoms. We don't want you walking around with massive amounts of heartburn and feeling, you know, like there's a flamethrower in your chest. We don't want that at all. But the problem again is that none of these medications are really getting to the underlying cause of the problem. If the underlying cause of the problem is something like H. pylori, or it's a food intolerance, or even some kind of other dysbiosis like a small intestinal bacterial overgrowth or a fungal overgrowth, you really want to be getting to the underlying cause and not just trying to block the symptom. And so these are great to use in order to improve quality of life. But if you don't do the digging and the investigation to find out what else is going on, you might find that you have to take these for the rest of your life if you're not careful. And by ignoring that underlying cause, all sorts of untold problems may develop in a year's time, 10 years' time, 25 years' time, etc. Now, these products don't come without their own risks. Some of these, although not so much now, you'll see that in the past, some of the over-the-counter products, not necessarily the ones I've listed here, I don't want to get into trouble for defamation and criticising unduly, but some of them contained aluminium salts to alkalinize the stomach. Now, aluminium is really a toxin. It's a heavy metal. It's very debatable whether we want aluminium in our bodies at all. So, a bit of a problem with some of those products if you believe that aluminium could potentially cause a problem, and certainly if you're using those products on a regular basis. By blocking the stomach acid production, there seems to be an association with some of these medications, particularly the proton pump inhibitors, and a reduction in nutrient absorption. So vitamin B12 deficiency in some studies has been associated with the use of proton pump inhibitors. There's some evidence that maybe magnesium levels decline because it's not being absorbed properly when the acid levels are knocked down. And so we've got to remember that the stomach acid is there for a reason. When we're getting older, as I've said in a previous video, the stomach acid levels tend to decline. The heartburn and acid reflux rate goes up. So it would actually indicate that maybe by trying to suppress acid, we're almost promoting the problem because if the stomach acid levels are declining and heartburn goes up, we've talked about how the stomach acid levels affect the efficacy of the lower esophageal sphincter. If that lower esophageal sphincter stays open as a result of low stomach acid, not enough stomach acid, and then we put these drugs in there to reduce the stomach acid even more, are we really doing ourselves a favor with that? And so there's quite a lot of ins and outs to this. It's not straightforward, but the take-home message is these strategies are absolutely fantastic for keeping the symptoms under control, but using these medications and these products long-term might not be in your best interests. What I would advise is to do some investigation while you're taking these to try and find out what's actually causing the heartburn and the reflux. And if you need to adjust your diet, adjust your lifestyle, get the right testing for H. pylori, SIBO, things like that, then that's what you need to do. Otherwise, you may get into trouble later on. So I hope this video has been helpful. We're going to talk about how we can actually get you off some of these medications with the help of your doctor in the next video. And we're also going to talk about some investigations that we can use to try and figure out what these underlying causes actually are. So I hope this has been helpful, hope you've enjoyed it, and I will catch you in the next one.